addition to working with mental health promotion in my professional life, I also deal with my own mental health challenges. In December 2019, I was diagnosed as bipolar, and so that was kind of right before COVID hit, so it was a really interesting time to be trying to navigate what was a pretty big thing in my life. And I think there were some challenges that were added to because I'm a trans person. I ended up in PsychEmerge, and the nurses used my pronouns when they were in the room, but I could hear them outside of the room using the wrong pronouns for me. So making sure that healthcare professionals are cognizant of kind of anything that their patients could be hearing or experiencing. It's not enough to just show up in front of your patient. You need to make sure that their entire experience there is an affirming experience, so that patients will continue to come back and folks will continue to come back and access services and feel like they have a safe space to do that. And one of the things that happened during COVID was that I lost a lot of my community supports because we were obviously so isolated. And it's been really, really healing to be able to come back to community and to be working on a program where my mental health experiences are not something that I should be hiding, but something that actually brings richness to my work, something that I can share with participants in the program that actually brings value to the work and allows them to feel like they have a space where they can talk openly about their mental health experiences. So I think another lesson for healthcare providers would be leaning into creating spaces for community to connect with one another, whether that's through peer support groups or different types of peer-led programming. But being able to connect with people who've had similar experiences to your own can be so, so powerful. In addition to the Investigators programs, we run 2 other health leadership programs, Pivot and Totally Outright. Pivot teaches folks about advocacy and systems change, and Totally Outright teaches about sexual and reproductive health and how community members can take control of their sexual and reproductive health. And the Queer and Trans Health Collective also runs a fantastic program called Peer and Peer, which is a peer-led harm reduction initiative. All of the members of the Peer and Peer team have lived or living experience with substance use, and we offer a bunch of different programming and services, including the provision of safer sex and safer use supplies, peer counseling, service connections and navigation. So it's a really wraparound kind of approach, and we work really closely in partnership with other organizations in the community. And I think a big lesson to take from that is really listening to what community wants and being responsive to community needs. The entire program is directed by a community advisory team, so we don't make any major programming decisions without their input. And we really just, I guess, have our kind of pulse, or our finger on the pulse of what's happening within the community. So, for example, when MPOX hit, we are in the community, we know what's happening. We were ready and able to immediately respond and start showing up in community spaces and getting folks the information that they needed.